Based on your, I mean, you work at Georgetown Hospital, but I mean, there are about 10, a total of 10, 11 people responding to this tragedy. What was your overall assessment of the team at the time, uh, and what they were confronted with?
I think they were overwhelmed. It was a lot more than they were accustomed to or they were prepared for. But I must say that with them being limited in their numbers and their resources, they did a pretty good job as dealing with the situation. And I think it was a difficult situation, but I think they did well. If you ask me, I think they did the best they could with whatever they had.
Do you think, see your assessment, do you think more medical personnel would have led to a lower mortality rate, a lower number of persons dying? Do you think? Could you tell us?
No. To be honest, the persons who died in the fire, so medical personnel would not have helped there. I don't think much more medical help would have reduced the mortality, but medical help would for sure have helped in, because the staff was overwhelmed. They were asked to do like shifts. They were 24 hours without sleep, and that's where additional help would have, been of benefit. One of the things that I found was that was challenging was the numbers that were milling around. That was not there. That was kind of distracting what the medical team, should be focusing on. There were about 10 to 12 students in a room, and there were people going in and out checking on them that did not really need to be there. They had no injuries. The problem was that they were brought to hospital. Their dorm was burnt down. They had nowhere to go sleep. They had no clothing, nothing. So that was a very stressful event for them. To have them in an environment that had the patient care happening actively was impacting them as well as impacting the function of the medical staff.